Hello everyone, this is Dr. Aman and welcome to the YouTube channel fmge with Dr. Aman. In the previous video, I have talked about the esophagus. That was the esophagus part 1, and this is the continuation of that video. This is the esophagus part 2 video. In this video, I'm going to share very two, 5 or 6 small topics which is left, but that is small topic, though they are very frequently asked topics and very high yield topics in the esophagus. And some topics have the link with the some other subject also. Some have the ENT linked also. So if you talk about the Jenker's diverticulum, of course Jenker's diverticulum is very frequently asked topics. So you have to know everything about the Jenker's diverticulum, even the their anatomy, the triangles, the Killian's triangles. You have to know what kind of muscles defects there, and even in the muscles they ask the horizontal fiber or vertical fiber. So even you have to know the or everything about the muscles and their fibers. And then even you have to know the also the age group and what to say, and the treatment part also you have to know in the Jenker's diverticular. It's very important. Second very important is the ecclesia cardia. This is the motility disorder basically. So you have to know the ecclesia cardia, you have to know the nutcracker esophagus. These two things you have to know in the very details. Even the ecclesia cardia, I think so many times they have asked the image based question, the X-ray but weak appearance they ask generally, but so many times they ask the the clinical scenario also. So you have to study the ecclesia cardia in the very details. And after that, the third topic we have to study is the esophageal perforation. Perforation part is very important. So if you talk about the perforation, we have to know about the Boyer-Haave syndromes. Boyer-Haave syndrome is very frequently asked, and there is one DD of the Boyer-Haave syndrome, that is mallory-based tear. So you have to know how to differentiate between the Boyer-Haave syndrome and how to differentiate and the mallory-based tear, both clinical features and their treatment parts and their clinical history. So you have to know both of them. Apart from the perforation part, you have to know some infections part of the esophagus. And the infectious part of the esophagus is like the Candida esophagus. They ask the feline esophagus, eosinophilic esophagitis. They ask the CMV esophagus. Basically, they ask the the X-ray. They ask the image based question from that part. So you have to know even though that also. And the one more topic that is very important esophagus is hernia. The hernia, the sliding hernia. Their types and their image based questions also they ask. So you have to know the sliding hernia, their all types, their image based questions, and their treatment also. So this about this sliding hernia, this is all about. So this was all about the esophagus. That's it. You have to know only this much, not too much. So just make sure that you complete these all topics. And I think this is enough for esophagus. There are 2 videos on esophagus. Just go and watch and make one combined notes of these all topics and just go through that. This is enough, I think. Thank you so much, guys.